Hello everyone, my name is Abby and I will be massaging the beautiful Lauren today. She is harboring a bit of a mid-back injury, so we are going to be focusing on the shoulder joint, the pec, and the rib cage, just to see what's going on. So first I'll tune into the thumb joint, which connects all the way through this bicep into the anterior shoulder that we're trying to work with. As you can see, there's shortness between the pecs and the anterior deltoid right here. And I would like to create some length to give that mid-back a break. The technical term for a rounded upper back or mid-back is kyphosis. And kyphosis, typically because of driving, computer work, studies, everything that puts you in that forward hunch position, shortens the pecs and the front and anterior of your chest and your shoulders. When this happens, the muscles in the upper back, like the trapezius and the rhomboids, get pulled, taut, lengthened to overcapacity, and hypertonified due to the stress. So sometimes when you feel pain or injury in your shoulders, mid-back, upper back area, you are really feeling the symptoms of the shortness in the anterior line. I'm going to focus on some smooth motions up the bicep, which can be quite tender depending on whose bicep it is. All in preparation of the shoulder joint. Because of the shortness in the front of the shoulder, that can translate to shortness in the bicep, in the radius bone of the forearm, and this meaty thumb joint, all related. I'm going to come in and start palpating the latissimus dorsi and get her prepared for a little bit of deep work in this armpit. Making sure to be quite gentle as I look around within the shoulder joint, seeing what muscular development, tension is causing this shoulder to shorten anteriorly. I'm feeling a relationship with the scapula and the subscapularis. I'm going to cup my hands under the scapula from the other side and press my fingers in and up and down to the subscap, which is just a muscle that lays on the inside of the scapula. And now I have it pinned from both sides. And I'm going to follow where the tension is taking her shoulder. As you can see, we're almost going into that medial downward rotation, that shortness of the pecs and the front of the deltoid and shoulder joint. But as we get here, it's revealing dense tissue on the infraspinatus and all the way down into the tricep. At this point, I'm going to pen the tricep down with both my thumb and my first finger and see where the anterior deltoid and pec attachments are wanting to go. There's one attachment that is particularly tight. We can go in, apply a little pressure. It can be helpful sometimes to also check in with that upper trap. This area can take over a lot of work and shortens, reacts very easily. Going to try and understand the relationship between the shoulder joint and the rib cage positioning. So I'm tuning in. Looking for areas that are rotated or twisted out of place. A lot of the times the latissimus dorsi can kind of glue to this side ribcage area. Applying deep pressure in the area when it is warmed up and when they're ready can be really helpful to any tension or injury in the shoulder joint. Remember, these areas are connected. When I grab onto the tricep, I can engage with the lats in order to get that tension in tricep to back down, to stabilize the joint and to relieve the pain. When your clients shorten their muscles or react, go ahead and follow them to wherever they need to go. I'm going to go ahead and tune into the whole of the rib cage. I know that this ribcage was a bit affected by the injury in her mid-back. So I want to see what compensation patterns, what places that this area is stuck in. Be careful, there are 2 floating ribs down in this lower area. It's not pleasant to slip up on them. But if you lightly engage and do not press too hard, you can begin to pull and tug on the fascial webbing just underneath the tissue, the skin. When you're able to pull on that fascial webbing, you're able to shift the position and the structure of the body part or of the region itself. Now that we've gotten the rib cage more medial, I'm going to come back to these pec attachments, squeezing the thumb joint, making sure her mind knows where we're going. And once again, trying to negotiate this shoulder joint back into place through a lengthening of the pecs and traps and a stabilizing through the lats. Sometimes with the shoulder joint, you can create leverage, being extra sensitive to where their bones are interested in going. Still working on some tension in the triceps. I'm going to stand and come up here. I think this one will catch it though. I'm applying just enough pressure to bring the head of the humerus back into the joint. Now the issue is the tension in the pec and the tension in the bicep. But by showing her brain and her body what that joint feels like, she might be able to find it again. that concludes our massage for today. Before we end this video, I'd like to shout out to a few of our Patreon members, T. Patel, Albert Germany, and Jimmy S. And if you enjoyed our video today, please check out our Patreon.